Yes, my name's Brett. Thank you for inviting me here to talk about survivorship, which of course I'm going to be doing through the prism of my own experience with cancer, which began shortly after this impeccably timed family holiday. A couple of days after this picture was taken, the large lump in my neck was biopsied, and thus began my cancer journey, which I have to admit it's not a term I love. It feels like it should be a good thing, a journey. It feels like a bad advertising campaign, which is a marketing fail right there. Worst holiday ever. Plus, in my case, the biopsy site, which you can see here, got seriously infected. I wound up in hospital for 6 days, and it wasn't quite the gentle on-ramp to cancer that I had hoped for. A little more information. My diagnosis was HPV positive squamous cell carcinoma. The lump on my neck, which you can see here, although this is inflamed because of the infection. That's actually the secondary tumour. The primary tumour was of unknown origin, but probably the left base of tongue. For my type of cancer, I had the regulation 7 weeks of chemo. That's me on my first day, and 35 rounds of radiotherapy to the neck and throat, which you can see here on my second day. The left side here copped the full blast, and the right side got a bit less, maybe 2/3. Now, I guess for some further context, it will become clear why I'm telling you all this soon, I hope. I compose music for a living, and so I was really anxious about losing my hearing, which is a common side effect of a chemotherapy drug called cisplatin, which for my type of cancer is the gold standard drug of choice. So there was a lot of agonizing. Actually, the first person I spoke to didn't get it at all. And then the second person I spoke to, chemo oncologist, was brilliant and totally got it. And there was a lot of decision making that had to be done, and we decided to drop me down to a second-line chemotherapy drug instead, which was a calculated risk. You'll see where I'm heading with all this shortly. As an aside, unfortunately, this second-line drug contributed to a heart attack, which is a side effect of that drug, and I ended up in hospital, and I had stents inserted. It's a picture of me on the day. I don't know if you know, but they don't let you get out of bed. You're not allowed to stand up when you've had a heart attack. So I thought I'd show you a funny picture of my Apple Watch being extremely unhelpful. Although when they did let me finally go to the toilet, I was gifted a private bathroom because my pee was so toxic. So I guess the silver lining, the things your brain does. Now, where I'm heading here is the psychological stuff, which all cancer patients have, but these are all very different. And so for me, the big issue was I got dropped down to a third-line chemo drug. That drug had even less well-known efficacy for my type of cancer. And so just to give you an insight into what's going on in our heads, because survivorship actually starts, as you know, from the moment of diagnosis. I was already pretty scared about all this, but this was actually highly distressing. I will never forget, rather embarrassingly now, and I look back, pleading to my chemo oncologist to please let me stay on the heart attack drug because I didn't want to go down any further. My fear was, of course, that I'd made a terrible mistake. The decision to preserve my hearing and what I thought would be a quality of life issue had put me at greater risk of cancer. But then I'm also weighing that up, thinking, well, but maybe this was all a good thing because this event helped reveal an underlying heart condition, which if left untreated could have killed me. This is all the stuff that's messing with my head. We all have variations of this, and we're all also wrestling with the injustice of it all, or at least most of us are. It happens very fast. Why did I get cancer? Why did I get a heart attack? I mean, I'm fit, I'm healthy, I do all the right things. I exercise regularly. I've got very low cholesterol, almost no risk factors. But the point is, of course, that in the context of survivorship, this stuff is important. I know I'm preaching to the converted here, but it's just the compressed timeline. Like it's so fast that there is often not enough time for clinicians at all levels, nurses, everyone, to sort of ask these questions, dive deep into histories, and find out what patients' fears and priorities and anxieties are. I think we often assume that we know patients' anxieties, and yet often they can be completely different. Like in my case, the hearing was absolutely a massive stress. And of course, as you all know, if these issues are unaddressed, they can play a massive role in how well, we cope with and recover from treatment. And that includes compliance and long-term adherence with treatment as well. I've known people who have cut short their treatment because some of this stuff hasn't been addressed. So, okay, let's talk about treatment for a second. At least I'll talk about mine. I can't speak to others. As many of you will know, the short-term side effects of head and neck cancer are pretty grueling. The radiation, in my case, does shrink and destroy the tumor in my neck, and hopefully it's also killed any remaining cancer cells in my tongue. But obviously you do get radiation burns, quite severe ones on the outside of your neck and inside of your throat. And there's a lot of collateral damage to other structures, which means that eating is very difficult. And many of us end up with feeding tubes. Now, again, everyone's cancer experience is unique. I can only speak to mine, but I would argue that we all have trauma or traumatic parts of our treatment. Mine was probably not being able to taste or eat. I can't believe what that did. I'm not a foodie, but it was very distressing. And then there's the fact that I know this sounds illogical, but you sort of feel a bit like a failure. Like not everyone needs a feeding tube, or not everyone, some people seem to cope quite well, other people don't. And then you're obviously grieving all the things you've lost. In my case, it was loss of taste. Now, of course, these are all good things. Feeding tubes are a good thing, of course. Here's a picture of me being fed my food lunch and my chemo lunch at the same time. So efficient. But we each have our own treatment-related trauma, which comes with us after treatment ceases. And so that's what I want to quickly talk about now. What happens afterwards? For my money, this is in terms of survivorship, this is where the biggest gap in patient care lies. Certainly in my experience and everyone I've spoken to, it's hard to convey how safe you feel during treatment. I mean, it's obviously horrible, but I'm in there 5 days a week, pretty much every day. There's a routine and structure, and you feel very held and looked after. But the moment you finish treatment, and this is not hyperbole, it honestly feels like you've been dropped off a cliff. You are largely alone, professionally speaking, and there's an expectation that you'll sort of get on with it and figure it out. But it is a devastating kind of chasm into which you have to leap because nothing truly is normal anymore. And so each of us has to deal with their own short and long-term side effects. Here's some of mine, or some of ours. These are obviously both physical and inevitably psychological side effects. And some of these, indeed, for some people, many of these remain for life. And yes, you do get to see your radiation oncologist for, in my case, 20 minutes every 6 months. But you've got these daily challenges that you're dealing with all by yourself. And yes, there are highs as you recover, but there's also a lot of lows as you navigate, the path towards what they call the new normal, which, if you can indulge me for a second, it's not a term I love. Some people do, but I don't, because for me, it implies like an endpoint, a point at which you reach finally, and then you're at peace and you've accepted it. I'm supposed to be at that point now. I'm about 2.5 years post-treatment, but mentally, I think the journey is often a lot longer than that. And new normal, sort of the new baseline, it sort of feels a bit dismissive of daily challenges that many people face. Not to mention the fact that for many of us, we can't believe we're still thinking about this stuff. You'd like to kind of bury it, but it's very hard to put behind you. And some of us, if I can reveal a bit too much of myself, I feel a bit guilty at times that I'm doing so well because I got off so easy compared to many others. I guess the point I'm making is it's really, really complex stuff, and it does last for the rest of your life, but no one shows you how to navigate this. There is no plans. Just a couple of quotes I found online, which I really liked. All right, so a couple more slides to wrap up. What can help? Well, again, I know I'm preaching to the converted, but survivorship to me, it's not just about being alive after cancer, but living well after cancer. And of course, that means, a whole of person approach rather than just treating the tumor. And I think we fall down a little here in this sort of recognition that for some people, the biggest challenges occur after treatment ends, returning to normal, whatever that is. Now, I'm aware that there's not a limitless pot of gold, but my fantasy wish list would be that support, including psychological support, would be tapered rather than kind of dropped off. I know that our GP is supposed to fill the gap, but I can honestly say that for every single cancer-related thing I've brought to my GP, who I like, bless his honesty, he's just said, Brett, I don't know. And then there's referrals, and then there's time and anxiety. Like I had neurological issues with my spine caused by the radiotherapy, referred around, eventually saw an expert who said, no, it's all normal. Same as a lump. I found a second lump in my neck, and I don't know if you can quite understand how triggering it is to find a new lump. But then imaging says there was no lump, and I'm like, but I can feel a lump, blah, 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 blah. Long story short, 5 months later, my radio-oncologist tells me it's all normal. It's just my salivary gland growing back. And so everything I've experienced, I've been very lucky, has been normal, but there's no one around to tell you that. What is filling the gap are very important things. Unfortunately, these things aren't a substitute for formal medical treatment, but things like peer support groups. I'm a member of one at Peter Mac. Online networks, Facebook groups, etc., hotlines. Head and Neck Cancer Australia just started one. This one here is my own personal favourite. I'd love to see peer mentoring programs available to any patient who wants one. I wish I had more time to talk about this. We've just started a program at Peter Mac, and I've experienced firsthand the benefits, both informally as a mentee during my treatment, but also more recently as a mentor to others. They're great programs. And unfortunately, they're all many patients kind of have at the moment. And if I had more time, I'd talk about trust in the system as well, and how important some of these programs are, these support groups are, to overcome trust deficits that some patients have in the system. And finally, in closing, I just want to acknowledge you all in the audience. I've got a lot of gratitude for you all. At the moment, I'm cancer-free, fingers crossed, but I just wanted to briefly thank you all for your care and dedication in helping people like me. Thank you.